the one thing that we could contribute to what you're doing in the UK at the moment is the experience of having not a national health service, but a regionalised health service where the county councils have the full responsibility, even of funding, of taxing the population and funding healthcare. And that has allowed Swedish healthcare to experiment with all the stuff that you are trying on now. So I don't think there is one part of what you are discussing, except perhaps giving all the money to GPs, that one or another county council in Sweden haven't tried in a small scale. So you could look upon Sweden as a testing arena, and the stuff you want to try out, you could look at Sweden and see what effects did they get when they tried this or that. Because we've tried, we have pricing competition and in one or another part of Sweden, all the stuff that you are discussing. And we've been trying it out for the last 20 years. So,
what's worked well in Sweden?
That very much depends on who you're asking. But 20 years ago, 15 years ago, there was a mantra going through Swedish healthcare that it doesn't matter who the provider is, as long as the financing is done in solidarity and common. And the same thing was done with schools before we started doing it in healthcare. So in schools we have like 20 years experience of seeing what that leads to. And there are some rather disturbing effects that we are starting to see. The grades have become better and better in the privately run schools, but the effective learning hasn't followed the grades. So the grades are better than what the students actually can show that they have learned. And there are some deep questions about equity, where the well-functioning students have the same prestanda that they did before privatization. But for the worst-off parts of the population, we've seen a decrease. So the gaps have widened. And they are financed equally. And that brings into question if that mantra is true. Does it not matter who provides? And the answer has been, bit by bit, we have been forced to make more regulation, more control. And the cost effectiveness provided perhaps by the private, is that eaten up by all the regulation, all the transaction costs? So there are some deep questions. I don't think that we have enough research. I would encourage Nuffield Trust to do some research on these questions before introducing reforms that we really don't know the long-term effects of.